Hi everyone, I'm Dr. Michael Richmond, a double board certified cardiothoracic surgeon. There's great news for women who suffer menopausal symptoms, especially for those of you who have a history of breast cancer after a new drug called Linkuit was approved last week. Linkuit was approved by the FDA as a once daily oral medication indicated for the treatment of moderate to severe vasomotor symptoms, which are the hot flashes and night sweats associated with menopause in adult women. So, as you know, menopause occurs when the ovaries stop producing estrogen, usually in a woman's late 40s or early 50s, or if you have breast cancer, even earlier. Treating its symptoms have long been difficult because the transition affects multiple systems, including temperature regulation, sleep, mood, bones, and sexuality. And the hormonal shifts vary widely among individuals. So that means no single therapy really can address all symptoms, and many overlap with other conditions, making menopause challenging to manage. Traditionally, hormone therapy is the most effective treatment for the hot flashes and night sweats, but as I said, it's not suitable for everyone, especially women with a history of breast cancer, where it's not okay. Despite how common menopause is, research funding to study menopause has been limited historically for a multitude of reasons. So how does this drug work? Well, the drug directly targets the brain pathways involved in body temperature control. Falling estrogen levels can confuse the brain's internal thermostat, causing sudden heat waves, sweating, and disturbed sleep in menopausal women. This new drug works by blocking neurokinin 3 receptors, which help regulate body temperature and sleep. By calming that signaling pathway, the medication reduces the frequency and intensity of hot flashes and related nighttime symptoms. Okay, now what were the human studies that led to approval? Well, the pivotal phase 3 OASIS 1, OASIS 2, and OASIS 3 trials were conducted at multiple North American sites and demonstrated that Linkuit, 120 milligrams daily, significantly reduced the frequency and severity of moderate to severe vasomotor symptoms compared with placebo, with a rapid onset of effect as early as 1 week, which is great, and a sustained benefit over 26 to 52 weeks. Improvement in sleep disturbance and menopause-related quality of life were also observed, and those were also statistically significant compared to placebo. The safety profile was favorable, with no evidence of liver toxicity, endometrial hyperplasia, which is a concern, or bone loss. And the most common adverse effects were inability to sleep, fatigue, and headache. And I know those two, it's a dichotomy. In OASIS 3, more than 80% of the participants achieved a greater than or equal to 50% reduction in the symptom frequency by the end of treatment. So with that, I hope you learned something today. Thank you so much for listening. For more information, advocacy guidance, or a consultation, you can go to my website at www.paladinmds.com and have a great day.